I work in the field of cancer research, particularly melanoma, and I'm working on treatments to improve the outcomes of patients who have melanoma, particularly the deadliest form of melanoma. That's melanoma that's spread throughout different organs in the body. Patients or people, particularly Australians, this is Australia's cancer. We have the highest incidence of melanoma in the world, and it is deadly. In fact, it kills 1,500 people a year within Australia. That's more than people who die on our roads. So it's our problem to solve, and we're making great strides, particularly in the last 4 years. We've seen the survival of people with the deadliest form of melanoma improve incredibly, but we've still got a lot more work to do, because approximately 30 to 50% of people are not benefiting from these wonderful improvements we've made for the other half. And so now we're focusing on that half, on how we can improve outcomes for patients with the deadliest form of melanoma. And what's really amazing is the things we're doing in melanoma can be impactful across all cancers, and we're starting to see that impact now. Other cancers are taking on some of the treatments that we have developed for melanoma. We're looking at various different treatments that can harness the immune system to kill off cancer cells. So rather than a drug that kills the cancer cell directly, we get the immune system to do the work by ramping up the immune system. We're also looking at very specific drugs that target a specific aberration or abnormality in the cancer cell. So the drug goes to the heart of the problem and kills the cancer cell directly. They're called targeted drugs. So in melanoma, we have been working on 2 streams of drugs: immunotherapies that target the immune system, and targeted drugs that target the heart of the problem with the cancer cell. And that's where we've seen incredible success. So for example, only 5 years ago, a patient with the deadliest form of melanoma that had spread would survive 1 year. About 30 to 35% of people would survive 1 year, and only 15%, that's 15 in 100, would survive 2 years. We've now hit a 2-year survival of way above 50%. More than 50 in 100 survive 2 years, and we think we're curing people now. We just want to make that 100% cure rate. Melanoma affects everybody. It affects the young, the old, men, women. In fact, it's the highest incident cancer in people less than 40 in this country. So it's a big problem. It disproportionately impacts our young people. And when you get the deadliest form of melanoma, you're not in the community anymore. You can't work. You need a lot of support. So by looking at these treatments and curing a proportion of patients and extending their survival, they have an incredible quality of life. They're back at work, contributing, enjoying a normal quality of life, which is fantastic. We just want that for everybody with the deadliest form. I went into medical research because I wanted to impact not only the individual I see in the clinic as a doctor, but populations of people. And I wanted to try and do that quickly. And one way to do that is to do medical research where you're looking for innovations that might impact large numbers of people. So that's why I went into medical research.
How did melanoma end up being your field?
Melanoma was an opportunity. Only 5 years ago, the survival of anyone who had the deadliest form, that's the form that spreads, was only 6 to 9 months. And we had tried drug after drug over decades. When I say we, I mean the collective medical research community. Nothing impacted that 6 to 9 months. And I thought it was an opportunity. It was an area that needed work, and something had to be done. And being an Australian and having an abundance of people who were suffering from this disease meant that you could really do some good work because you had the disease right there at your doorstep to explore, examine, and to do research on. And so melanoma felt like the right cancer that needed the right research. And we've had those breakthroughs. So that median survival, 6 to 9 months, has gone way above 2-3 years now. And as I said, I think we're curing a proportion of people where we weren't before. And we've still got more to do. Until we cure 100% of people, we're not going to stop. The other thing we're working on now is, because we think we're doing such a good job in the deadliest form of melanoma with drugs, we're starting to move those drugs into the early phase to see if we can prevent it from spreading around the body so that we never have to deal with that deadliest form at all. We've got a wonderful, very big program at Melanoma Institute Australia. So one aspect is the treatment side in terms of drug treatments and extending survival for the deadliest form. The other side of it, for example, is looking at family risk, why some people develop melanoma in particular family clusters, what genes drive that. Then we have a very large branch looking at prognosis and diagnosis and treatment of early stage melanoma. We have an education program for people with melanoma, for other physicians and researchers with melanoma. And the other thing we do at Melanoma Institute Australia is treat our patients. So clinical service, education and research, and our research is vitally dependent on our patients. The two big important things at Melanoma Institute Australia are our tissue bank. We have the largest tissue bank in the world with melanoma specimens that our patients give to the tissue bank. The second big important part of our research is our database. We have the largest database in the world of patients with melanoma. We have more than 40,000 patients in that database. That data and that tissue drives some of the most fundamental research across the world, including the recent genome atlas of melanoma. We contributed over 50% of the melanomas to that international effort. Also, the staging system, the clinical diagnosis, Melanoma Institute Australia has contributed over decades to forming the staging system, and in fact 50% of the patients that go into forming that staging system come from our database. So on the world stage, what we're doing with that tissue and with that database is incredibly important, not just for Australians, but for all people in the world suffering from melanoma. Medical research is important because medical research is where we find the new innovations, the new ways to keep Australians and the community, and in fact the world, healthy. And healthy people make a healthy world. Australia needs to fund innovation. We need to keep putting funds and energy into finding new ways to improving the health of the community so that we can contribute to a vibrant, lively, active, working, healthy community. And we need to fund research that continues to innovate in making sure we have the healthiest Australians possible.